Good morning. Good morning, Your Excellencies, fellow partners, ladies and gentlemen. I bring greetings from Dr. Carissa Etienne, Director of the Pan American Health Organization, who has asked me to represent her in this event. It is a pleasure to have the opportunity to address this distinguished panel and reflect on the current context of COVID-19 and the achievements of ICPD and SDG agendas through South-South and triangular cooperation. The COVID-19 pandemic has been the greatest health crisis the region of the Americas and indeed the world has faced in over 100 years. The Americas continue to be the region most affected by the pandemic, with recurring waves of transmission. As 11th of November of this year, the Americas reported more than 94 million cases and more than 2.3 million deaths. 5 countries of the Americas are within the top 10 countries in the world with the highest number of cumulative deaths. But as all you know, every country in the world has been affected across all ranges of the development spectrum. All throughout this pandemic, we have seen the commitment of our member states who hand in hand with PAHO have made great effort to overturn the situation and defeat this pandemic. Our technical cooperation has contributed to the strengthening of the vaccination rollout. Some 48% of people in Latin America and the Caribbean have been fully immunized against COVID-19, but coverage still much lower in various countries and territories, and challenges continue to be daunting. Already in the pre-pandemic period, millions lacked access to quality, comprehensive care, and many countries reported important access barriers, including the high burden of out-of-pocket expenditure. These underlying conditions resulted in a higher impact of the pandemic in our region, affecting the most vulnerable. The data is clear. Vulnerable populations are at greater risk of infection and deaths from COVID-19. According to data from ECLAC, the United Nations Economic Commission for Latin America and the Caribbean, the COVID-19 pandemic has set our countries back almost a decade in terms of level of poverty and extreme poverty. The challenges that we face are serious. Health systems in every country have been weakened. We recognize that member states have worked to quickly build ICU bed capacity and ramp up hospital services to care for COVID-19 patients. However, other essential health services suffered. More than half of the countries in the Americas have reported disruptions to mental health services and routine immunization programs. Essential health services for reproductive health, maternal newborn child, adolescent health, and nutrition care were interrupted in more than 40% of our countries. That means most people in our region did not have access to the basic essential health services that they require for continued health and well-being. We need proactive solutions. During the pandemic context, the lack of universality and equity in access to services and appropriate coverage resulted in high social costs and impoverished the most vulnerable population groups. Indigenous people, Afro-descendants, and remote rural communities had limited access and were further compromised by the limited priority given to the first level of care. Lockdowns, quarantines, and reorganization of health services also directly affected access to essential health services. The impact was felt in different levels, particularly in the case of women, girls, and other vulnerable populations. Furthermore, we have seen that access to medicines, due to the lack of products or logistic challenges, were impacted by the COVID-19, and we have worked hard with member states to act proactively and to minimize those difficulties. Likewise, The increasing on gender-based and domestic violence has been a major concern that threatens well-being and health rights. We know that the challenges that all our countries have faced in responding to COVID-19 are a consequence of persistent inequity and social injustice, long-term structural deficiencies in the health sector, and years of inadequate attention and poor public investment in health. Over the past decades, public spending in health, while slowly increasing, has been persistently low in the Americas, and in many cases inadequate, averaging 3.7% of GDP, far below PAHO's recommended 6% of GDP. A third of healthcare costs are borne by the household. As a result, 95 million people suffer catastrophic health expenditure, and 12 million are driven into poverty. We need to increase levels of health financing and improve utilization of resources to address inequities, eliminating out-of-pocket expenditure, and increasing efficiency within our systems. We are seeking a new way forward based on solidarity and collaboration. In one end, greater investment in health research is required to apply scientific evidence in public policy making and in a manner whereby politics and ill-informed ideology cannot distort health decisions based on science. And most importantly, investments in science, technology, and the industrial base in developing countries is essential so that we build self-sufficiency and are better able to respond to future health emergency needs when they occur. On the other end, leadership in health is key to transform our thinking and the way we envision health by implementing people-centered policies. This is where we are now. We need to close the gaps that were exacerbated by the pandemic and address the systemic and structural deficiencies that have been exposed in our health systems by COVID-19. Universal access to care and universal health coverage are overarching drivers of health and sustainable development, where everyone has the right to access comprehensive, quality, and integrated health services without incurring financial hardship. We should take this as an opportunity to reinforce technical cooperation mechanisms and strengthen South-South cooperation, recognizing its full potential as a tool to achieve robust health systems. Developing countries, including those in Latin America and the Caribbean, must be prioritized through international solidarity for intensified support in the face of COVID-19. Vaccines must be made available to less well-off nations, and solidarity-based mechanisms such as COVAX must be supported not just with offers of financing from countries, but with concrete and sustained commitments by all stakeholders. As we look forward into the future, PAHO is working directly with public institutions and private companies in Argentina and Brazil to strengthen their capacity to develop and produce COVID mRNA vaccines in our region that will benefit all countries in Latin America and the Caribbean. This is a strategic and long-term project to reduce our vulnerability and dependence by establishing regional capacity for this innovative technology, strengthening South-South cooperation, and benefiting a major number of developing countries. In the future, this also helps us to combat other viral diseases of importance in the region. Across these efforts, we have learned the value and importance of leveraging our collective resources and working together to save lives. Although multilateralism suffered during the pandemic, South-South cooperation has remained active, showing that promoting solidarity between countries and strengthening coordination between key stakeholders is essential. We must continue fostering South-South cooperation and consolidating partnerships in order to achieve our national, regional, and global health objectives, including the ICPD agenda and the SDGs. South-South cooperation and triangular cooperation have been instrumental in supporting our countries to tackle the challenges brought on by the pandemic and to muster efforts towards the achievements of the SDGs. We have seen how Argentina has shared their laboratory capacity with countries of the Caribbean in the field of antimicrobial resistance. We have witnessed the solidarity between Peru and Bolivia to improve access for life-saving health services in the context of the COVID-19. Countries in the Americas have joined forces to establish surveillance mechanisms and information sharing platforms, which has proven crucial in the response to the COVID-19. And there are many more examples. Distinguished colleagues, while we continue to tackle COVID-19 and look to a future post-pandemic, we must remain committed for the realization of the ICPD Program of Action and the achievement of the SDG agenda. We will continue to work with member states to rebuild and strengthen health systems as part of the right to health. And most importantly, we will need strong political leadership and the willingness to implement structural and transformative actions across health, social, and economic sectors. The pandemic has impacted us all. Together, collectively, we must act to work towards more inclusive, sustainable, resilient, and inclusive societies that will allow future generations to survive and thrive. Thank you very much, Madam Chairman.